Hello, I'm Amir, CEO and founder of Pocket Clinic. More than 460 million people suffer from a chronic illness called diabetes, which means 1 in 11 people among us. Life of 10% of them depends on a drug called insulin, although this is a lifesaver and keep them alive, but it's not an easy drug to administer. In these modern times, still most of diabetes use old-fashioned treatment, which is syringe, and it causes overdose or underdose due to inaccurate calculation that they make. More than 1 million children are insulin dependent and 128,000 diagnosed each year and added to this number. Imagine that they are dealing with unfixed dose drug 24/7 for lifetime. It should be a better way for them. Yes, there is. This is the newest technology that market offer. It is what it looks like. It's a piece of hospital equipment that was basically developed in a medical device mindset. It is very complicated, expensive, and almost 40% of a user stop using it within 9 months. It's not a consumer device, and for these disease, that's what we need. This is our goal, living where real people live, which is a smartphone. This is the most effective, most compactful human-machine interface ever developed in history. To inform our solution, we joined diabetes patient community and asked them what their biggest challenges were in managing their disease. And we ended up connecting directly with 150 patients and 10 doctors, and we found out 2 of the biggest problems are. First, current solution is expensive, and in countries like Brazil, they're not covered by insurance. The second is the modern devices are completely closed ecosystem, meaning that is one size fits all solution that is not appropriate for managing each patient's needs. Our solution is not a mobile app. It's a consumer medical device that controls with a smartphone. It's pain-free, easy to use, and the smallest pump in the market. We use AI system to optimize the insulin dosing while delivering updates to family member. And our mobile application is open protocol, which means that you can upload any algorithm or connect with any sensors that you want. With our business model, we are able to reduce upfront investment, and with subscription model with fee, we can make it affordable for all income classes, even without insurance coverage. We are differentiated on 2 main dimensions, interoperability and price, which makes us unique in this market. The global market for insulin delivery devices valued $21.8 billion by 2025, and in Latin America specifically reached to $1.38 billion, and we're targeting 1% of a global market. Our team is divided in 2 sectors, engineering and medicine. Our team has overall more than 24 years experience in this field. In order to accomplish our goal, we are seeking an investment for $1.2 million, which is 300K of it is soft committed already. This money helps us to fabricate our first batch, grow our team, and apply for regulatory permission. Diabetes don't choose their disease, but they have the right to choose their treatment. Thank you very much.
Thanks. That's the right time. So, any questions right now?
What exactly, I must have missed this. How exactly do they administer the insulin?
Normally they use, most of the diabetes use syringe or injection by the pen. And because the pump, the modern technology is a little bit expensive. And here in Brazil, there is no insurance coverage that cover the cost of insurance, the pump.
Okay, so basically what you're offering is the analytics for the dosing. Is that correct?
No, we are offering the automatic injection that the cost is the same of the injection by the syringe or pen, which is controlled by a smartphone. And it has a capability to optimize the dosing because with the syringe, you make the spark of injection, for example, overdose or underdose to the patient because they need to inject 4 times per day. And it causes death finally if they do overdose or underdose. But automatically injection, which is automatically injected per hour, or when they have some carbohydrates, they calculate it by the mobile application, inject the correct amount of insulin wireless through the to the pump.
Thank you.
You're welcome.
So how big is the device? Did you have a picture of it?
Yes, in this is this normal size. As you can see, it's a wearable device.
Yeah.
It's attachable to the patient body, connected via Bluetooth. The size is 46 millimeter. The thickness is 1.2 centimeter. The smallest pump in the market, and it's a circle shape.
Hi, this is IK Kanu from Atlantic Ventures.
Yeah.
What stage are you in terms of your any FDA approval or testing? Because you'll be looking at it from an algorithm perspective, communications, because using Bluetooth between the phone and the device, and then also even the delivery system for the pump itself. So what stages are you in terms of testing and all of those?
Yeah, I'm finishing the manufacturing design, and 90% is done. And we are ready to apply for a laboratory test, because the pump is the class 3 in Brazil, but in most of the countries like the US, is a class 2 of classification. Just need to pass the regulatory of just passing the laboratory test.
Okay.
But here we need to do the laboratory test and apply for the clinical trial.
And what about the security protocol around the communication between the device and the phone?
Yeah, I'm using the new technology from the BlackBerry, and I applied the microprocessor that's cybersecurity, the communication between the mobile and the pump pod, which encrypted in a mobile application. When you send the command to the pod, it's completely secure.
Okay.
Okay, thank you. Thanks for your presentation.
You're welcome.
And